Hey guys, Dr. Rebecca Warren here, and I just wanted to come on here and talk about one of my favorite things, hormone and fertility and infertility, okay? I want to talk about this common misconception about when you can get pregnant. It is insane to think that there are only 6 days out of the month that you can get pregnant, that your body changes to be viable to hold a baby, to inseminate an egg. There's only 6 days. And yet we take medications, or doctors will prescribe medication to just turn off all hormones for 30 days. There's so much more to the female body and to the female hormones than carrying children. When you are wrecking your hormones, by not listening to what our bodies are saying, by being dependent on pills, we set ourselves up for a lifetime of struggle of balancing our hormones, whether that's while trying to get pregnant, whether that's postpartum, whether that's premenopause, menopause, and postmenopause. Being aware that our hormones communicate in whispers, that little changes create big results, big long-term results, will allow you to understand how important it is to keep your hormones healthy. We don't talk about the real serious issues that women are having with fertility or infertility, what they're struggling with postpartum, what they're struggling with menopause and premenopause. We don't understand the struggle until people are willing to be open enough, and then you understand how bad this problem is. And this is what I do on a daily basis, is sit across from women that are struggling, and this is their first time really sharing that. So one thing I keep seeing and I keep hearing is this fear. There's people and there's young people that don't want to get pregnant. And the truth is, you don't have to get pregnant, okay? But the underlying conversation that's not being had is the reason why there's so much fear between couples about being pregnant. The underlying issue is because women, for the longest time, you were taught to not understand your body. In fact, we were taught that our bodies are kind of like gross. We talk about cervical fluid and we call it cervical discharge. Like if there's something wrong with that, we don't look at our bodies. We don't even want to know what's going on down there. And unfortunately, the only time we even think about it is if we're having issues, and then we go to people that don't know how to help us. We have to talk about what our bodies are doing. That being said, there are three signs that are needed for fertility. There are 3 signs that are needed for ovulation. There are 3 signs that are needed to tell you you can get pregnant. What does that mean? You don't just get pregnant just because. It doesn't just happen at any point in the month. There are 3 physiological signs that must happen within your body to have the egg be produced, to have the egg implant, to have the egg available and healthy enough to, come together with the sperm and then to get pregnant. You don't just get pregnant just cause, okay? It's like saying there's no alcohol in my house, but I came across this empty beer bottle. I know I'm gonna get drunk now. That's what it is. When young women come in and they feel like, oh, I don't know if I can do this whole tracking method because I know a woman at work or a friend or a cousin that got pregnant. First of all, they did not pay attention to the 3 signs. And I'm going to go ahead and tell you, I'll give you a little disclaimer right now. None of the 3 signs I'm about to explain to you is just tracking when you bleed. Because that's what a lot of people believe. They believe if I track when I bleed and at the day 14, that's when I ovulate. Nope. I'm talking about tracking physiological signs. So there used to be a way of tracking that was just tracking when your days were, when you were bleeding, how far apart. That is not tracking your fertility. What I'm telling you right now is if you understand what your body is doing, you're not going to get pregnant unless you choose, if you choose to engage in sexual intercourse during this period of time, that's on you. You will get pregnant. But this is also really important to understand for people that are trying to get pregnant, that looking for these 3 signs of fertility makes it more accurate in regards to your ovulation. So you cannot get pregnant outside of these 6 days. And there are 3 major signs telling you that you're going to get pregnant if you have sex around this time, okay? And so that means if you fully understand what's going on with your body, then you fully understand what you need to do to get pregnant or to not get pregnant. And you don't have to depend on this pill that's just going to wipe out everything, and it's not even going to allow you to have true hormones or to have a true blood flow because it's synthetic and it's not real. It's not real hormones, okay? So what are those signs? Number 1, basal body temperature. Your basal body temperature is the temperature that you take before rising out of bed. So you're laying there, you kind of lean over, you put the temperature thing in your mouth. I have been using the Lady Comp, which tracks my temperature for me. It has like a Pearl Index of like 99.7%. That is the same amount as taking birth control, meaning the Pearl Index is to not get pregnant. Like what are the likelihood if you use this the right way, you're not going to get pregnant. But why is basal body temperature important? You cannot release an egg unless your progesterone increases. So day 1 through 14 ish, everyone's cycle is different, so I'm going to say ish in there. Your estrogen is rising and then it peaks. And when it peaks, then you produce an egg, and then you have high progesterone, or your progesterone starts to rise, and you need the higher levels of progesterone to sustain a pregnancy. You need it to happen to ovulate. You need this blood hormone to spike. You need your temperature to spike for ovulation to occur. And the spike can be like 0.2 to 0.5. So if you're tracking your temperature in the morning, and I like the women that I coach to use a graph, so Taking Charge of Your Fertility has graphs on there. We're looking at 97.1, 97.0, 97.2, and then as you're leading up and it's time to ovulate and the increase of progesterone, let's say it's usually around 97.2, you might go up to 97.7. And these graphs, they have the numbers to a point where you can see the spike. You cannot get pregnant without an increase of progesterone and without a change in your temperature. This is a solid sign that your body is changing and that ovulation is occurring. That's sign number 1. Sign number 2 is cervical fluid, not cervical discharge. So let's get that word out of your vocabulary. It's cervical fluid. It's telling you that there's hormonal changes happening in your body. When you have cervical fluid, it makes your reproductive area to be less acidic, and it makes it for the sperm to be more mobile. So it's your body saying, hey, I'm getting ready to get pregnant now, and so I need to create this fluid in order to allow the sperm to get where it needs to. So physiologically, you need to produce the fluid in order to become pregnant. This isn't an if and maybe. It must be produced in order to get pregnant. The last thing is the cervical placement, okay? And this is up to you if you want to check it. You can check for yourself the cervix placement. So if you're checking and it's low and hard, you're not ovulating, but your cervix changes. It changes because it needs to change in order to get pregnant, in order for a sperm and egg to come together. And so if you're ovulating, if there's a possibility that you're going to get pregnant, your cervix will go high and it will go soft. Again, I want you guys to understand, this is a very specific recipe to get pregnant. It's like saying, I want to bake a cake, but I'm going to leave out the oil and the eggs. You're never going to bake the right cake. You need every single spot to be perfect in order to get pregnant, which is why if you're wanting to get pregnant, you need to be aware of tracking these, not just one time, it's multiple cycles to truly understand your body. And if you don't want to get pregnant, guess what? The most accurate way is to understand and to learn your body. I always share my favorite resource is Taking Charge of Your Fertility, guys. I want to say this again. This is more than just being afraid of getting pregnant. This has everything to do with understanding your hormones as a real vital sign. According to ACOG in 2015, our cycles are vital signs. Let's not just ignore it. live in fear and feel like the only answer to understanding our hormones or to controlling our hormones is a pill. Thank you guys for tuning in. Make sure you share this video. There's so many young women, older women, women in all walks of life that have never learned this and never understood how powerful it is to be connected with our bodies. If you guys have any questions, make sure to leave a comment here, and I'll make sure to come back and answer that for you guys.